Hello and welcome. My name is Katie. I am one of a team of physiotherapists who are working with women during their pregnancy and in those postnatal months afterwards. And I'm going to be your host today. I'm going to be with Jen, one of my colleagues who you're going to meet later on. And you will have been sent this link because you've been referred to our team. Either maybe you've got pain in your back during your pregnancy or in that pelvic area. And we want to empower you. That is our aim. And we want you to understand how your body changes during your pregnancy, why you might be experiencing some pain, and two, we want to help you know what you can do about it. And there are some really helpful things, some exercises, some little tips that we'd like to share with you today. We would love it if you could watch all of the videos, the whole session, and then start to put some of those tips and some of those postures and exercises into practice yourself. And for some ladies, that's actually all you might need in order to manage well. But we are here for you. So if you're still struggling, please do get in contact with us. We're really happy to see you one-to-one, and we can do an individual assessment and discuss with you what else might be of value to support you. And we'll let you know at the end how you can do that and how you can get in touch. Do you know what? Your body is amazing. It adapts to provide all that your growing baby needs. But a number of ladies during their pregnancy, they do experience pelvic girdle pain. And this is just an umbrella term for pain in that pelvic area. So it might be in your lower back. It might be further down at the base of your pelvis, maybe the sides of your hips or around the front of your pelvis in that kind of more pubic area. And you might have heard it called other things. You might have heard it called sacroiliac pain, these joints at the back, or symphysis pubis dysfunction, which is these joints at the front. So here's our pelvis. This is a model. And what we know from the research is that your pelvis is really strong. It's resilient and it's stable. But we also know that actually during your pregnancy, your pelvis can be more sensitive to pain. And you can feel pain more easily. And the difference in pregnancy is that your body's pain response. So messages travel all the time from our body up towards the brain, and the brain decides what response is needed, if any. And during pregnancy, these messages up to the brain, they can become a bit supercharged. So actually those messages are faster and they're busier. And that pain response can come on more quickly and it can be louder. You can feel that pain more intensely than you might have done before. So the difference is the body's pain response during your pregnancy, and some people it can become a little bit wound up or overprotective. And this could mean that everyday movements that before were completely comfortable now actually produce pain. There are many factors that can influence this level of pain or this sensitivity. And some of them we can change and some of them we can't. And these factors include things like the normal hormonal changes that occur during your pregnancy, but two, the levels of stress or anxiety that you may experience. If you've had particularly difficulty getting insufficient sleep, loss of sleep can increase your pain. And there are changes with constipation or just the different demands that you're putting upon your body. Are you trying to do everything as you did before, or are you able to adapt with your changing body? One of the obvious changes during your pregnancy is obviously the physical changes that we can see. And normally your body weight sits beautifully over the center of your pelvis. But actually during your pregnancy, you are carrying a lot more weight with your growing baby at the front of your body. And this alters the pull or the loads upon your joints. And it's also just hard work for your muscles. It's just tiring. And imagine carrying a bowling ball around all day. It's going to be tiring and could make you ache. We do know that if you've had pain in a previous pregnancy or a trauma or an injury in that area, there is a little bit more chance that you would have pain in a subsequent pregnancy. But there are still a lot of really positive things that you can do that can make a difference. So we know from the research that this pelvic area is really strong. It is stable, it is resilient, but we know that it can become more sensitive to pain, and that the pain may come on a little bit more easily than it might have done before. So how do I change my pain? We're going to look at several factors. We're going to have a think about sleep. We're going to have a think about relaxation and breathing, which is always lovely. We're going to think about posture. We're going to think about how you move. And we're going to look at some really great starting exercises to build up the flexibility through your spine and to build up the strength of all those muscles supporting that pelvic area. We're going to have a quick think about general fitness, some tips for during fitness activities, and we're going to look briefly at diet and toileting too. Okay, so particularly during the time where we're going through the exercises, when we're doing the breathing, it'd be great if you could try joining in as we go. So you're just going to need space where you can sit down and space where you can kind of lie down. So that might be your floor, that might be on your bed. And then you can kind of use that as an exercise class to start working through those yourself. Okay. So before we look at things that are specific to pregnancy, I want to just mention two factors that have a really big influence on the amount of pain that we all could feel. And these are sleep and stress. So we know that the lack of sleep can increase the intensity of pain that we experience. So we would love you to really protect your sleep if you can. We appreciate some of you might have little ones in the house already, which is going to be a challenge. But see if you can develop some great sleep habits. So there are lots of things that are well known to be helpful for sleep. And these include having a regular time you get up in the morning, a regular bedtime, getting out into the sunshine during the day, avoiding caffeine after midday, and avoiding screens for an hour or two before your bedtime. And it's great at the end of the day to wind down, have some quieter time. Maybe you might find benefit in reflecting on your day. Some people like journaling, helps to clear your mind. Or maybe just doing some slow breathing. And we're going to talk a little bit more later on about what might be a good position for you to get as comfortable as you can in your bed. A second factor that can increase pain that all of us feel is stress. And so in times of busyness or pressure, sometimes it's great to stop and do some simple breathing. And I want to show you two breathing techniques now. So first of all, we're going to do SOS breathing, and this just means sigh out slowly. So I want you just to stop, sit somewhere where you're well supported, just kind of thinking about softening your shoulders, and you take a normal breath in and then a really nice long breath out. So it might be that you breathe in for the count of 3 and then you breathe out for the count of 5. Just breathing in through your nose and then breathing out through your mouth, that long, slow out breath. And this does a few things. It actually changes the adrenaline that's running in your body, the cortisol, all those kind of get up and go hormones that keep us moving. Actually, it calms those down. It's stimulating the vagal nerve, which calms these stress hormones down. And it encourages your body just to let go. So any tension you might be holding in your shoulders, any tension you might be holding in your tummy or your pelvic floor, it's encouraging those just to soften and release. So let's just do that again. Taking a nice breath in and long breath out. Excellent, one more. Well done. So you can just stop in the middle of the business at any time and just practice this SOS breathing. So I'm going to have a look at a different sort of breathing now, which is just normal diaphragmatic breathing or tummy breathing. And this is a sort of breathing that we should be doing all day, but it's very easy to kind of, if we're holding tension, end up with all our breathing up kind of in our chest, or particularly if your baby's kind of taking up a lot more room, we can get into that kind of upper lifted chest position. But if you can, just stop and soften your shoulders. Relax your arms and just notice your normal breathing, and just seeing if you can notice your tummy rising and falling. Just take note of that movement, and as you're doing that, your diaphragm just softens, that tummy naturally rises and falls, and just take notice as it does that. And as your tummy rises and expands, naturally that pelvic floor will be softening. And as you breathe out, naturally that pelvic floor just rebounds back to its resting position. So notice that tummy breathing, your tummy rising and falling. And you might be able to feel that softening and widening of the pelvic floor as you breathe in, and then just letting it go as you breathe out. If you can't feel that pelvic floor element, really don't worry about that. Just notice those slow tummy breathing. And this is a really good way just to pause in the middle of the day and stop and breathe. I want to talk briefly about pacing your activity. So we know that your pelvis is a little bit more sensitive, that pain can come on more quickly. And so there may be things that you're doing in your everyday that can stir your pain up. And we need to look at your everyday activities. So if you know that, say, walking 20 minutes causes you a lot of discomfort, then it may be that you're going to have to cut that back. Maybe you're going to have to take more breaks along the way, or maybe you're just going to have to walk for kind of less time in one go, if that's possible. So have a think through your activities and think, is there anything that you know is a challenge for you? Can you take more breaks? Can you break it up? Can you do some of that activity and then change to a lighter activity and come back to it? So just have a think through your day. Constipation. Did you know that if you're a little bit constipated, that can increase the pain that you feel in that back or pelvic area? And actually, constipation is more common during pregnancy. And so it's even more important that you can just keep really good toileting habits. And you can help this by drinking plenty, having plenty of fruit and veg and fibre in your diet just to keep everything moving well. And actually moving and exercising regularly is helpful too. But actually positioning on the toilet is more important than you might think. So we're going to show you a little diagram here. And actually by placing your feet up onto a low step, maybe a toddler step, this naturally relaxes the muscles around the back passage, around the bowel more effectively. And so it actually just does its thing with less effort, and it's just easier to empty your bowel. So maybe think about including a little step in your bathroom that you can use. When you're emptying your bowel, it's great if you don't hold your breath. And it's worth trying a kind of a swift out breath just to kind of make those pressures a little lighter, and it's just more effective. So if you're still struggling with your bowels and need any more help, you can always chat to your GP or pharmacist and see if there's any medication that can be of value to you. So I'm just going to mention briefly about maternity belts now. A lot of people ask us about these, and for some people just strengthening their tummy muscles and the muscles around the hip is sufficient, but for others actually having that extra passive support with the maternity belt just backs up your muscles, and for them that can make the difference in their everyday and all the activities that they need to do. So by all means consider getting a maternity belt if you think that would be helpful for you. There are lots of shops that do sell them. There's a lot online as well, and really they're just for when you're on your feet. They're for when you're up and about, to give you that extra physical support, to support the weight of your baby and just to support around your pelvis. I want to talk next about how we stand, how we sit and how we move, because we want to just keep our joints in their most comfortable positions and make things easiest on our bodies. And you might find during your pregnancy that your posture has changed a little bit. Some people find that they're arching or hollowing a little bit more through the base of their back. But other people go the other way. Some people find that they're leaning more into their heels and tucking their bottom under and even lifting their chest up out of the way of your baby. Some people tell us that they find that they end up being pulled down into a rounded position in their upper back. And we can get quite stiff, particularly in the upper back area. But any of these change postures and positions over time just put increased demand or strain on the joints, and it holds the muscles either in a lengthened position or a shortened position, and it makes it just a bit harder for them to do their job well for you. So if you can keep really good tall postures, this just really optimizes the position and really helps your muscles work well for you. So I'd like you to try standing. If you maybe even stand up now and try it with me. And just notice where your weight is in your feet. And if your weight's in your heels, then just bring it to the middle. So bring your weight equally to the fronts and backs of your feet, equally to the right and left of your feet. And then I want you to grow tall. Just lengthen through the spine. Almost imagine a little bit of string drawing you tall from the top of your head. And then from here, I want you to open through your collarbones and just melt those shoulders down. Let them sink down, keeping that long neck with a little soft kind of nod of the chin. And from here, hopefully you can just notice that gentle movement of your tummy rising and falling as you breathe. When you're sitting, this really tall upright posture is really nice too. And that upright tall posture just switches on these support muscles naturally. If you're sitting for any length of time, you're going to use the chair to support you. I'm going to grab something to show you. And what you can do is you can use a little rolled up towel. It doesn't have to be this big, but I sometimes find a little rolled up towel in the base of your back when you're sitting in your chair is really helpful, just to kind of encourage that tall position. Or some people really like rolling a towel up and putting it upright, vertically on your chair, and you kind of position it so it's between your shoulder blades, and again that's encouraging that tall open position through your chest. Even if you have the most perfect, beautiful posture when you're sitting, your body's not going to want to be still for really long lengths of time, and you're going to find that you need to get up and move a little bit more often. So if you have tasks or work that involve a lot of sitting, you're going to have to try and break those up and get up and move much more regularly than you did before to keep comfortable. We want to give you just a few little tips about the simplest way to move in a few movements that you're going to be doing every day. And we often find that when you're moving, you could have a tendency to hold your breath. And we'd encourage you to try and breathe out through your movements, because this just balances the pressures in the pelvis and it encourages those core muscles just to switch on automatically to support you. So when you're transferring from sitting down and you want to go and stand up, you're just going to take a natural breath in, and then you breathe out, and then you go to stand up. So it's just keeping that nice breath out as you move. Now, for some people, that movement to standing is just a little bit uncomfortable. There are a few things you could try. You could try pressing your hands out or pressing your knees out against your hands as you start that stand. So normal breath, breathe out, press into your hands, and then rise, and then sit down again. Or alternatively, you can practice or try squeezing your knees in. So you're going to breathe in, breathe out, press into your fist, and then rise again. And with doing these two things, if that's more helpful for you, then it could just be something you could try and use when you're moving. The reason behind it being helpful for some people is that it could just encourage these pelvis and these hip muscles to switch on a little bit more. Okay, if that makes no difference, you can just not worry about that last bit. All right, so we know that your pelvis is a little bit more sensitive during your pregnancy. And so bigger movements, particularly if you're moving one leg, like swinging it up onto a bed or stepping into the car, those bigger movements can be a little bit uncomfortable during your pregnancy. So I'm going to show you quickly a couple of ways that you can move which keep your knees together and keeping your ankles together to get the most comfort. So when you're going to get into bed, start sitting on the side like this. I want you to press your ankles together really lightly, and then you're going to tuck your feet up, drop down onto your forearm, and then from here you can come down to your lying position. If you're going to turn over, again, keeping those knees together, you're going to lift your bottom and just swing your bottom underneath. You're tucking your bottom under and bringing it through, and then even over onto the other side if that's where you're headed. Additionally, if you wish, you could draw that low tummy in actively. So you draw your low tummy in, tuck your bottom through in little movements back to your side to support your baby as you move. And then to go back to sitting, you're going to push back through your hands and drop your ankles off the side. Okay, so when you're sleeping, we want you to be obviously as comfortable as possible. So I'm just going to show you ways that you might find using extra pillows helpful. And I'm sure you'll have tried this already. But coming back to lying, you're going to need enough pillows to support your neck so that your head's beautifully in the midline of your body. And then a lot of ladies find that having an extra pillow between your legs, so running from your knees all the way down to your ankle, it just holds this top leg in a comfortable position. It just aligns it with the rest of your body really well. And often this is going to feel easier. Some people prefer, if they want that bottom leg straight, you might just have a couple of pillows underneath just to keep this top leg aligned. Some people choose to have a little folded towel underneath your tummy to support your baby, particularly kind of in that kind of second trimester stage. And this top arm often is more comfortable supported on something. So you can have a big fat cushion in front just to rest your arm on in front of you. Now, as we've said with sitting, even if you've been in this beautiful, perfect posture for a while, you're going to need to move a little bit more frequently. So you'll find probably you're going to need to turn over through the night to the other side and reposition all of your pillows. Okay. So as you can see by the way we got in and out of bed, that actually symmetry is really helpful. And so to keep your knees close and keep your ankle close reduces the strain or the demands upon your pelvis and that sensitive area. So things like getting in and out of the car or getting in and out of the bath, some people find that that big stepping movement isn't that great for them. So instead, it might be worth changing how you do this. So a lot of ladies choose instead to put their bottom first into the car. They walk their feet round, then they're facing the front, ready to go. And then when they're ready to stand up, to get out of the car, they will walk their legs round first before standing. Some people even choose to put like a little plastic bag underneath their bottom on the seat, so it's easier to kind of swivel round in your seat. Other things that tend to be a little uncomfortable are really activities which require you to stand on one leg for a while. So actually instead, for dressing, for putting your shoes on, for putting your trousers or your leggings on, it's worth sitting down. And it's much easier, there's less demand on your body if you can sit down to get dressed.